Hello everyone, today I'm going to show you about fungal pneumonia in immune-compromised children. Cause of immune-compromised state in children. Immature immune system, premature infant, primary immune deficiency, chronic granulomatous disease, shock syndromes, severe combined immunodeficiency, Wiskott-Aldrich syndrome, discharge syndrome, acquired immunodeficiency, immunosuppression, infection, chronic illness. Most common sign symptoms aspicularis, high fever, cough dyspnea, pleuritic chest pain, hemoptysis, candida, hoarseness, low-grade fever, tachypnea, and chest pain. Pneumocystis, tachypnea, hypoxia, and fever. Coccidioidomycosis, cough fever, chest pain. Cryptococcus, cough dyspnea. Histoplasmosis, chills with fever, malaise, anorexia, dyspnea. Epidemiology. Asparagus, most common species Asparagus fulminatus and Asparagus niger. Biggest risk for invasive aspergillosis is neutropenia. 5 to 13% of patients after bone marrow transplant. 5 to 25% of patients after solid organ transplant. 10 to 20% of patients with leukemia who receive intensive chemotherapy. Most common cause of mortality in children granulomatous disease. Candida, most common species Candida albicans. Major cause of morbidity and mortality in ICU and ICU. 10% to 20% of all nosocomial bloodstream infection in ICU patients. Third most common cause of nosocomial bloodstream infection in premature infant. Most common fungal species in burn unit. Risk central venous catheter, invasive intervention, treatment with broad spectrum antibiotic. Pneumocystis. Most common species pneumocystis cerevisiae, formerly P. carinii. HIV is major risk factor. 8. Defining illness. Risk increase with decreased CD4 count. Most non-AIDS cases are seen with corticosteroid. High risk in patients with lymphoid malignancy. Without prophylaxis, rate of infection 22 to 45%. Coccidioidomycosis, most common species. Coccidioidomycosis and Posadaceae, endemic in southwestern United States. Risk for exposure increased with snow, high wind, earthquakes, and construction. Cryptococcus, most common species, Cryptococcus neoformans, endemic in southern California, associated with avian guano. Histoplasmosis, most common species, Histoplasma capsulatum, endemic in Ohio and Mississippi River Valley, associated with bad guano. Increased risk of exposure with construction. In the meeting, base clue, pneumonia that does not respond to broad-spectrum antibiotic. Angioinvasive pulmonary asparagus, classic finding of halo signs at crescent signs and cavitation. Halo signs, 11% of patient nodule with halo of ground glass attenuation due to hemorrhage. Air crescent sign, 2% of patient represent retraction of necrotic line. Cavitation, 25% of patients typically occur as neutrophil count recover. Candida consolidation cannot be distinguished from bacterial pneumonia. Pneumocystis extensive ground glass opacity with interlobar septal thickening. Coccidioidomycosis, unilateral consolidation, hilar adenopathy, pleural effusion, pulmonary nodule, cavitary lesion, reticulonodular opacity, cryptococcus, pneumonia nodule, miliary or large, histoplasmosis, pre-existing infection, calcified pulmonary nodule, calcified hilar, or right paratracheal node, acute infection, mediastinal or hilar adenopathy, miliary nodule, diffuse consolidation. This is contrasting CT of the left lung in a child with febrile neutropenia, so poorly defined opacity in the left lobe with a fan halo or ground glass opacity. This was later confirmed to represent angioinvasive pulmonary aspergillus. Again, this is contrasting CT of the chest in the same patient, obtained 3 weeks later, so angioinvasive pulmonary aspergillus cavitation represents signs of recovery or as the neutrophil count increase. Contrasting CT of the lung with immunocompromised children, child so diffuse tiny pulmonary in a centrilobe distinguished distribution that the patient was confirmed to have disseminated histoplasmosis. Contrasting CT of the left upper lungs in a child with a history of cystic fibrosis, so mucus impact bronchi and a three input pattern of pulmonary nodule, which can be secondary to allergic bronchopulmonary aspergillosis. Contrasting CT in an adolescent patient with acute lymphoblastic leukemia and asparagus infection show the region of ground glass opacity in the right middle lobe. This ground glass opacity will represent hemorrhage. Surround cavity in which the presence of the air completely eccentric and dependent focus of necrotic lung capital. Treatment antifungal agent depend on type of fungus. Thank you.